So in the first section, now we talked about the antepartum post-term pregnancy, and then we also talked about ABO incompatibility. The another common complication of pregnancy or antepartum complication is vaginal bleeding. So in this second section, now we will talk about the vaginal bleeding. And we will talk about what are the causes of vaginal bleeding or antepartum hemorrhage, how we can take the history of the patient or with the antepartum hemorrhage and how we can perform the examination, and also what are the different investigations and management of antepartum hemorrhage. So vaginal bleeding in pregnancy. The vaginal bleeding during pregnancy is common and very common effect it has on the patient that it can lead to anxiety. Patient gets very anxious why this bleeding is occurring, whether it's some complication, whether the pregnancy is affected, or whether some complication can occur as a result of this hemorrhage. So patient becomes very anxious with the antepartum hemorrhage or bleeding. Before 24 weeks of pregnancy, usually there are chances that it may be a threatened miscarriage. So anxiety is due to mainly that patient thinks that they may miscarry the pregnancy. Threatened miscarriage is that there is not loss of pregnancy, but there are chances that patient might miscarry. The os of the cervix is closed on examination, but patient is bleeding. The management of this threatened miscarriage is usually the very, very strict bed rest, and the patient should stay in the bed and until the condition improves or get better, or if allowed, symptomatic management can be performed. So before 24 weeks of gestation, usually it leads to threatened miscarriage, and after 24 weeks of gestation, this antepartum hemorrhage is mostly the cause of its vaginal bleeding can be placental complications or some local abnormality that can cause vaginal bleeding. The placental causes are very common, usually abruptio placenta, which is the separation of the placenta. If you see, this is placenta, if it's separated from the wall of the uterus, it can cause very bad hemorrhage and bleeding. Manifestations of vaginal bleeding, usually patient is pale, she has tachycardia, fast heartbeat, anxious woman, painful firm abdomen. Abdomen on palpation is painful, tender, and it's firm because of bleeding, it's firm. The underwear is soaked in fresh blood, it's fresh, bright red bleeding. Fetal movements are reduced and need emergency assessment. Cardiotocography can be performed to assess the fetal heart rate, and then if it's accelerated, if it's not, or decelerated, that can be managed there. So all this is important. Then management for a possible placental abruption. Abruptio placenta is a very common complication as a result of high blood pressures. Females who have high blood pressure during pregnancy can lead to abruptio placenta, or any injury or a fall. All these can lead to abruptio placenta, which can cause the fetal mortality because of decreased supply of blood and oxygen. So all these are the causes of vaginal bleeding. Before 24 weeks, leads to threatened miscarriage. After 24 weeks, it can be local injury or it can be due to placental causes. Next, causes of antepartum hemorrhage. Placental causes, we said, are the local causes. Placental causes can be abruptio placenta, placenta previa, and vasa previa. Three very common causes, placental causes. Placental abruption, as I mentioned, it's the separation of placenta from the uterine wall leading to bleeding. And then placenta previa. This is the diagram showing the placenta previa. In this, the placenta is low-lying and it covers the os of the cervix. Cervix is the lower portion of the uterus that dilates during pregnancy and from where the baby is delivered. So when the placenta covers the os of the cervix, then there is hindrance to the delivery and it can cause serious and severe hemorrhage and fetal mortality. So placenta previas are always, patients with placenta previa are delivered with the C-section. So this covers the internal loss. Another placental condition is vasa previa. As the name show, the blood vessels are before, and then when the baby is delivered, these vessels can bleed and cause hemorrhage. All these are the placental condition or causes of antepartum hemorrhage. The local causes that can cause hemorrhage, cervicitis, which is the inflammation of the cervix. If you see, this is how the normal cervix looks, and this is the cervix with cervicitis or inflammation or infection. Then another local condition is cervical ectropion, turning outwards. Ectropy is turning out, entropy is inward, so ectropion. Cervical carcinoma, vaginal trauma, and vaginal infections. All these are local causes. They can be treated, they can be managed, and then normal vaginal deliveries can be performed. Sometimes certain infections can inhibit the normal delivery and C-sections are usually performed, especially the STDs that can be transferred to the newborn babies. So these are the causes of antepartum hemorrhage. Next, history. What are the different questions that should be asked to the pregnant women with vaginal bleeding or antepartum hemorrhage? How much bleeding? How much blood loss is important? Because if it's too much blood loss, it can be dangerous for the mother and for the fetus, and then arrangements should be performed for the transfusion. So how much bleeding is important? What is the triggering factor? What causes the bleeding to occur? Whether there is some pain, if there is any trauma, injury, fall, or it is post-coital bleeding, that should be asked. So further incidences should be avoided. If it is associated with pain or contraction, that is again important. With the uterine contraction, usually it should be treated and the contractions should be stopped because it can initiate the onset of early labor, a preterm labor. Is baby moving or no movement is felt? What was the time or when was the last cervical smear is performed, whether it was normal or abnormal? So these are some very, very important questions that should be asked when taking the history of the patient with the antepartum hemorrhage. Examination, pulse, blood pressure is very important with the bleeding. If blood pressure is low, patient has chances they might go into shock with extensive severe bleeding. Is uterus soft or tender and firm? Fetal heart auscultation is very important, and then speculum vaginal examination for visualization of the cervix, whether there is some local cervical lesion present or not, local vaginal lesion is present or not, whether the bleeding is from some local cause or from other cause. So all these can be done on examination. Investigations depend on the degree of bleeding. Full blood count is important. Clotting factors are important. If there is suspected abruptio or placenta previa, and then cross-match 6 units of blood. Cross-matching is important if blood transfusion is required. Ultrasound is performed to find out the fetal size, presentation, amount of amniotic fluid, placental position, and morphology. So ultrasound is very important to find out the fetal well-being, whether the heartbeat is normal, whether the movements are normal, whether the placenta is, if there is abruptio placenta, placenta previa, all these can be diagnosed with the ultrasound. So full blood count is important, and what's the amount of hemoglobin, and cross-matching should be performed. So all these are important investigations, and depending on how much is the bleeding, they can be performed on emergency basis. Management is symptomatic management can be done if it's an infection. Candidiasis is very common during pregnancy. Antifungal drugs are used for candidiasis. Cervical carcinoma is excluded by history and visualization. In the pregnancy, we can also use the medicines which are the herbal medicines, because they are more safer in the pregnancy as compared, because less side effects, and then mostly antifungal medications. These are all the managements for infections and for the symptomatic management of the patient with antifungal, with the antepartum hemorrhage. That was all about the vaginal bleeding and antepartum hemorrhage. Thank you for watching sqadia.com.